tell me, what condition do you have?
I have COPD and fibrosis of the lung.
Okay, and what were you doing for that, Dale, before you went to get the treatment with the stem cells and so forth? What were you doing before?
Going to the hospital frequently with pneumonia. And the pneumonia, of course, made both worse. And there's very little that they could offer me at home. Medication. A lot of things for asthma. I've been asthmatic since age 2. And a whole lifetime of that has damaged my lungs.
Okay. So, can you tell me, how were you feeling before you had the adult stem cell treatment? How were you feeling before that?
I was coughing a great deal, sometimes for hours at a time. And no matter what medication I took, it didn't control the coughing. There was a lot of mucus involved. At bedtime, I'd take my medication, and then in the middle of the night I'd wake myself up so congested that I couldn't breathe and have another coughing attack. And that has certainly diminished since having the stem cell treatment.
So when you were going to your doctor before, what did your doctor say about doing this treatment?
About doing it, he said that with what I had very little options, and to go for it.
When you went in to have the adult stem cell treatment done, go ahead and tell me about that. What did they do when you were there?
Dr. Burks explained it to me. He was very thorough. I was quite impressed, and he told me that they would enhance my stem cells, and that what they were using from me was the same age that I was. And I thought that was fascinating, because you hear the controversy about stem cell treatment, and in this case there can't be any, because it's your own that you're using, and you will have no rejection of it, and there will be no problem with your own coming back to you. And that's been the case for me. No problem, no pain.
Okay, awesome. Can you tell me what happened with your symptoms and how the treatment affected you after you had it? Tell me about what happened after you left.
Well, I didn't feel anything for a few days, and then I began noticing that there was less mucus, less pain when I breathed, and a feeling of difference, more of a load lifted off my back. I mean, I just felt different. And there are many people here who have noticed my illness of the past year, and they kept coming up to me, people I barely knew, and saying, "You look so much better." And they're still saying that, "You look so much better." And I look like something that was ready to go before I had the treatment.
Can I ask you what symptoms you had before that are different now? Can you elaborate on the symptoms that have either changed or are the same?
The chronic cough. I would not have been able to talk to you this long without having several coughing spasms that were long and noisy.
Can you talk a little bit about the emotions you were going through before you had the stem cell treatment and compare them to the emotions you had after? Like what the emotions were when you were going through it, the disease, before you had the stem cell treatment?
Before I had the treatment, I believe I became depressed. What hope was it? I was miserable. I was coughing. I couldn't go anywhere. Seemed there's no hope. And then when I read about the stem cell treatment, I thought, there is hope. And I will try it. I believe it will work for me.
How did this change your emotional state of mind after the treatment?
After the treatment, I didn't feel depressed anymore. I felt that I was doing something. I was going forward.
So,
and that I was...
How did the clinic handle this? How did they teach you to do the things when you leave, so that you have the routine when you leave the clinic to treat yourself?
They gave me a sheet of directions, very simple, easy to read. Showed me how to use the syringes and fill the container for nebulizer. And there was not much to it. And just to have several hours apart between the two treatments, which I do.
So, can you tell me about how the nurses or the nurse or the staff or the doctor was? How did they handle things?
I do have a wonderful nursing staff. When I needed help at home, I would call, and they had the answers for me and reassured me and got me on the right path again. And they're very knowledgeable, well-trained, and very professional.
So, how would you compare this to other treatments you went through for what you're going through?
Superior.
Can you tell me how it was superior?
Everybody knew what to do, and they worked as a team. Everything meshed. And
what would you tell somebody considering using the adult stem cell treatment and the way that you're approaching the issue you have with your lungs? What would you tell someone else?
I'd say have no fear. Try it. Think positively that it's going to help you.